Hello, DS here, founder owner Greenwood Dental. Welcome back to another episode of POP series. Again, POP stands for Patient Outreach Program, and I hope you guys are enjoying those videos. Today I'm talking about what you guys could do or need to do when you have jaw pain or jaw clicking or jaw tenderness or jaw inflammation. So let's review the reasons why you could have any of those symptoms. Now, if you have clicking of the jaw, my personal experience and my observational data tells me that I need to look at whether some of you had extensive ortho treatment. Basically, if you wore braces for more than 2 years. The reason for that, sometimes when we are designing movement of the teeth or designing realignment of the teeth, we tend for small mouths to push the teeth back to straighten them out. And that sometimes puts a lot of pressure on the jaw, and we have popping or clicking. Also, the other reason could be trauma. If you played a lot of sports, especially those our favorite cheerleaders, if you are a base and you had, again, somebody fall on you, or you had a lot of sports trauma from hockey, football, basketball, or even just falling a lot, or had a car accident, or even had jaw surgery because of trauma, that will contribute to the way the jaw actually function, and also will interfere a little bit with the anatomy and the way it functions. So that's as far as clicking and popping. Restriction of your movement, it could be muscular, meaning that if the muscles are overly engaged or they are overly working, sometimes you guys can trigger inflammation, and some of us might have some scar tissue in the muscles, so when they are engaging or they try to move, you'll have that limited or restrictive movement. Pain. Usually the jaw pain is basically, again, muscle aches, muscle tenderness, or I have seen muscle swelling. Patients have swollen muscles that will interfere, again, in the range of motion of the jaw. The last thing is it could be also just pain. I have patients that will lock their jaw open or lock their jaw closed because everything is so tight and tense, and that will create a lot of pain. So now the second half of this video is about what could you do, or what are your options when you have jaw pain, whether it's or jaw malfunctioning or jaw restriction. So one of the first things we start with is to evaluate and manipulate the jaw and see what is causing the restriction of movement or what's causing the discomfort. And typically, especially if there's discomfort involved, what I try to do first, put you guys on anti-inflammatory or muscle relaxant, especially if it's super tight with severe cases. I will send you home with some exercises for the jaw to do every single night and see if that can loosen up things, including with the warm compressors too. The second option will be wearing a night guard, depending if your muscles are constantly engaging and you have a chronic habit of clenching and grinding, we'll put you in a night guard and we'll adjust that accordingly. The third option is to get Botox. Sometimes injecting Botox in some of those, intensely engaged muscles will temporarily paralyze the muscle, and refer to my Botox video, and that will help things relax and help things heal, and hopefully we can get rid of the inflammation. If you happen to lock your jaw open or lock your jaw closed, unfortunately, sometimes we won't be able to manipulate the jaw back into their natural position, and we might refer you to the emergency room, or we might refer you to an oral surgeon to manipulate the jaw open or close. But after that, we would put you typically on, again, some anti-inflammatory or muscle relaxant to relax everything so they can heal. So these are basically bottom line troubleshooting as far as the jaw is concerned, but it really depends on your symptoms, depends on the results of your evaluation. It will determine the route of treatment that we would put you on. So I hope this helps, and I'm out of time again. I will catch you on the next video. We love you. Be safe and DS out.